And good morning to all our viewers. Again, this is our second edition of interviewing our Level 1 members. And today we have the pleasure of meeting and greeting and introducing Janine, who is Schnugh van Jaarsveld's partner in business. Tell me the name of your practice.
It's Schnugh van Jaarsveld, Audiologists.
Schnugh van Jaarsveld, Audiologists. And So I wanted to start with just saying hello, introducing you, and we see that you have been in private practice since 2003, I apologize. And when is that when you and Schnugh opened the practice, or were you in private practice previously and then opened together?
So I started in private practice in 2003, where I worked for somebody, and then I joined in with the practice. So Schnugh and I together, we bought into a practice, and then what happened is that in 2020 we had the opportunity to just open a practice for between the two of us. So since 2020, it's just been the two of us. But before that, we did have another partner, and before that, it was basically working for other people.
Okay, and how's it been? I know that it's quite a juggle, I must say, in making sure that you find the right partner and that you can work together. It's quite a big thing to go into business with someone. That's what I found, is we got particularly lucky because we get along really well, Lauren and I, and things work, but it's not always the same in every business. So how's it been working in a partnership?
So I have to say I am very fortunate, because if you want anyone as your business partner, you want Schnugh van Jaarsveld. She's amazing. Really and is. The two of us work really, really well together. So Schnugh and I have very similar ways of thinking. We believe in ethical practice, 100%. We're very focused on our staff. We want a happy working environment where everybody feels comfortable, because we feel that if you are not looking after your staff, they're not going to look after you. And also the other thing is, if you don't have a happy working environment, people immediately feel that. So because we think the same, because we believe the same things, we get along really well, and we also both work very hard in the practice. So we're not in the practice to run it from a distance. We don't want to own the practice and then watch everybody work for us. We really want to get our hands dirty and get involved. So being in practice with Schnugh is really wonderful, and it's very important to find somebody that thinks the same as you, and has the same ethics as well.
Yeah, absolutely.
Janine, I just want to know if Schnugh is actually sitting next to you when you're saying those lovely words.
She paid me. No, I'm joking. No, absolutely. You got it. She's poking me here from the side. No, I'm joking.
So I see that your practice is quite a diagnostic, very clinical practice. You see a lot of walk-ins, patients that are referred from your multidisciplinary team that you work quite closely with, and that is one of the nicest things to be able to be exposed to, and to be able to really see some cool clinical and diagnostic challenges, weird cases, interesting cases. So tell me a little bit about how your practice runs and what type of patients you tend to see on a daily basis.
So we, on the Fourways side, we're based in a hospital. So we have a very big diagnostic component of the practice. Olivedale, we've got more hearing aid sides, a lot more hearing aid based patients. But at Fourways, we work in an incredible environment where our cardiologists, our urologists, the pulmonologists, everybody takes a holistic view to the patient. So if the patient in the ward complains of a hearing loss or difficulty hearing, or they notice that the patient's having difficulty hearing, they'll refer them for a hearing test. So that's a completely foreign environment, I think, to most people, but because it's a newer hospital, I think that it's been encouraged, the multidisciplinary approach. I work with two very good ENTs, and so they do refer a lot of interesting cases. The one ENT, his special interest is in viral infections or sudden onset hearing losses. So we do see a lot of unilateral hearing losses here, which he tries to treat and restore hearing as much as possible. So as a result of that, we do fit a lot of cross systems, Bahas for single-sided deafness. So that's a very interesting part of audiology. And then we do get a lot of pre-operative and post-operative hearing tests, which is interesting to see. So the other ENT sends for all her patients for pre-operative testing, and then we get to see what it looks like afterwards as well, after the tympanoplasties and the mastoidectomies and all those. So that's also very interesting.
That's amazing. So in my practice, we were originally based at a hospital, and we used to get a lot of ENT referrals, pre-op and post-op tests, and also the sudden sensory neural losses. And about 5 years ago, we moved our practice away from being based at a hospital. And it was a risk, of course. We were very nervous to not get that constant referral of diagnostics. And I must say that we've missed that a lot. We used to see a lot of it, and we don't. So that's one big thing that I've noticed in our practice, and would also, part of wanting to increase awareness between professionals is to start encouraging ENTs to keep referring. And it's amazing that you're working with two ENTs that are actually doing that. So that's amazing.
Yeah, I think you've also hit the nail on the head there with regards to awareness. That's been part of my drive in this hospital, is awareness of what an audiologist is and what an audiologist does. So whenever a new specialist comes in, whatever they do, try and go and introduce myself and say, why would they, explain why would they refer to me? And that's part of why the pulmonologist and the cardiologist, refer, is because they're aware that there's an audiologist, and this is why I need to send my patients to her. So we have to punt ourselves, we have to sell our skills and make people aware that we are necessary to the patient's whole wellness.
So talking about cross aids, what is your favorite cross aid at the moment to be working with? What have you had good experience with, and what has been positive in terms of cross aids that are on the market?
So my favorite at the moment is actually the Schnugh AX. The reason why, it's easy for the patient to use, rechargeability is there, and also the affordability as well. The cross section is not as expensive as a hearing aid. So when you are looking at the patient's budget, it actually fits in quite nicely, and the technology is lovely. So it just works. I don't have a lot of troubleshooting issues. So I've been fitting a lot of Schnugh AX crosses.
Janine, I would like to ask, in terms of, you mentioned single-sided deafness. You see a lot of patients with that criteria as well. Is there a protocol that you usually follow in terms of cross or Baha, and what has been your experience? What have you fitted most?
So we actually fit a lot of Baha. The ENT that I work with he does a lot of Baha fittings. We counsel the patients, and we actually end up trialing both. So we do a cross system, and then we do a trial with a Baha system. And really, at the end of the day, it's up to the patient as to which one works best for them. So we have a look and we see, do they benefit most from the Baha, or do they benefit most from the cross? And most patients tend to go with the Baha system. That implant and the sending the signal across via bone conduction seems to give a really nice clear sound. We tend to do cross a lot more when the patient has a loss on the other side. So if it's a simple single-sided deafness with normal hearing, then they tend to go for Baha more. but if it is a hearing loss on the opposite side, then obviously they do hear better with a cross system, because we can amplify on the side that has a hearing loss as well.
Janine, I wanted to ask, do you assess their functionality and their benefit in an objective way, or do you do it through subjective questionnaires? Do you do aided testing in the booth? How is it that you're able to discriminate or to discern really which product is working best for your patient?
It's a combination, really. So it's obviously subjective. The patient has to say, take the device home, use it in the environment, and see how they benefit. With the Baha, we like to do, aided thresholds as well. So just to make sure, and obviously for medical aid purposes, they also want to see that. But yeah, then we do the aided thresholds and we see how much benefit they are getting from those devices. So it's a combination. Also counseling, we need to explain to them, about what are they looking for? Why? How should it be better? With single-sided deafness, it's quite difficult because they've suddenly lost hearing. Now we're putting amplified sound there. So they need to have quite a bit of counseling to understand it's not like their normal hearing that they had 2 or 3 months ago.
And isn't this the beauty of being an independent audiologist, right? Where we can choose and offer the patient choice. And at the end of the day, it boils down to what they're most comfortable with in terms of quality of sound, as well as the fit of the device. I've noticed some people don't want to have surgery, but don't want to wear a soft band. And then we tend to go for a cross system. And I'm involved with cochlear implantation, so that's always an option for us as well. Do you ever have to refer for cochlear implant if a cross or a Baha hasn't been successful?
Yes, absolutely. So we work closely with the Johannesburg Cochlear Implant Center. And we do have cases where it's just not possible to do Baha or hearing aids and cross. And then we send through to the Johannesburg Cochlear Implant Center, and they're amazing. So yes, cochlear implant is definitely on the cards for our patients that don't benefit from Baha or hearing aids. Yeah. And I just want to say, also in this whole story, with the single-sided deafness, why an independent audiologist is so important is we really do walk a journey with these patients. When I work with single-sided deafness, I view it as somebody's lost a limb. When you lose a limb, it's a big thing. Losing your hearing suddenly in one ear is a big thing. So these patients, they want someone who's going to understand, who's going to take the time to counsel them, who's going to look at all the different options. And it's time and it's a relationship that you actually develop with these people. And that's, I think, where independent audiologists are important, because that's what we do. We take the time and the effort with our patients and really give them the care and the support that they need.
Janine, I can see that you have a heart for people just by the way that you're talking. And I wanted to know, sticking with single-sided deafness, and you also mentioned sudden sensorineural hearing loss. Have you noticed, because I've seen, especially obviously with COVID, and it being a viral infection, have you seen an uptake in people experiencing sudden sensorineural hearing loss in your practice?
Yes, definitely. So because I work with the ENT who deals with sudden onset hearing losses, we would on average see about 3 or 4 sudden onset hearing losses a day. It's increased dramatically. We see between 5 and 7 people with sudden onset hearing losses. And a lot of them now are related to COVID. So part of the case history is they've had COVID recently, and while they were recovering, all of a sudden they noticed that their hearing was feeling full, or their ear was feeling full or blocked, or they developed a sensitivity to sound. And then that's when we pick up that they've got this sudden onset hearing loss. So there's definitely a link. There's multiple things to consider, but one of the things is that COVID, because it affects the immune system, maybe it's triggering a shingles virus that attacks the nerves. So definitely there's a link.
So Janine, I want to know, obviously when a patient comes in with sudden hearing loss, they are quite anxious. How important is it for you and your practice to guide that patient when they come to you? Because oftentimes an audiologist might say, look, I don't want to say anything that's maybe going to give the patient hope, because I shouldn't say anything about the medical diagnosis or so forth. I'll leave it to the ear, nose and throat specialist. How important is it for you as a practice when that patient comes to you to guide them through that anxiousness?
I really think that information is key. There's obviously we can't diagnose, but what I tend to do is say, these may be the options. If it is this, then this is what's happening inside your ear, or if it's that, then it could be this, so that when they go to the ENT and they get their diagnosis, they already have some knowledge. Because people are afraid of what they don't know. So we can't diagnose, but we can explain how does the hearing system work and exactly where the problem could possibly be. And then the ENT can take it from there, because they don't really have the time to sit and explain how a hearing system works from front to back. So I find that if you give them information, they feel a lot more relaxed. We can't promise them their hearing's coming back, but we can say we'll do everything but the ENT will do everything within his power to try and recover that hearing. But worst case scenario, this is what we're looking at, so that they've got all the facts in front of them. There's no use in hiding those facts from them, because they'll eventually get there. And I think they feel a little bit more assured that you know exactly what's happening with the situation. You've seen this before. I do explain to them, we see this every day. You're not unusual, because people feel, they're the first person they've ever heard of that's got a single-sided deafness or a viral infection, and they feel like they're odd or they're unusual. So it's nice for them to know that they are not alone.
I wanted to ask something, because in the past where we've done awareness campaigns specifically for GPs, where I find that a lot of patients will go to a GP before they go see the ENT, because they think that it's just an infection, or they think that it's some wax. And that for me is a critical period of time, because we know that any sort of treatment, whether it's corticosteroids or whether it's hyperbaric oxygen tank or chamber, needs to happen within the first 72 hours in order to get an improvement or to see a change based on that, the medication and the treatment that's usually quite comprehensive and quite aggressive when one needs to treat a single-sided deafness. Do you find that in your practice people are being referred quickly to the ENT and quickly to the audiologist? Are you seeing people that had an incident within 72 hours, or are you seeing them much later?
It depends. So our ENT who deals with it, he basically goes around to the GPs or sends them information to say, this is what you need to look out for. This is when you need to refer. If you're not going to refer, then for the first week, this is how you need to treat it. Or so we've got a lot of GPs in the area that send for audiograms first, and then they treat off the audiogram. If the patient hasn't shown any improvement after a week, then they refer to the ENT. But that's a very unusual situation. So if anyone comes from another GP who isn't aware, then we find it's been 2-3 weeks before they actually get the treatment that they need. And as you know, then it's much more difficult to treat, and sometimes the hearing doesn't completely come back. So yeah, awareness, this is what our ENT is on about, as well as even amongst his colleagues. He's trying to make them aware of how to treat it, because he follows the protocols that they do in America. So he does a different way of treating to other ENTs as well. So awareness
That's
is
interesting.
Key.
I wonder if your ENT is willing to share some of those resources with our members, And if we could give a checklist of some sort to GPs, and every member contacts our GPs that we work with, and to share that and network in order to get those referrals to audiologists or to ENTs as soon as possible. Do you think that he'll be willing to share?
Absolutely, he will. Absolutely. I will speak to him, because it's not something we learn at varsity. When he sat me down and started explaining and showed me Prof. Hammersmar's article on PGE, polyganglionitis episodica, I had no idea initially. So it's been a journey for me as well to learn about this, but he'll be more than willing to share that information.
That'd be wonderful, because with every interview, we'd like to also be able to use it for educational purposes, for our referral sources, but also for the public, anyone that's watching this that might have experienced single-sided deafness and you think, gosh, there's nothing that can be done. There are so many options. It might be not possible to restore the hearing or to treat it medically or surgically, but there are certainly opportunities and a variety of devices that one can use to start hearing better. The other thing that we see is that Sybrand and you have something in common.
Musicians and tinnitus.
Yes. So tell us a little bit about that part of you and your life. And yes, it's so interesting.
So when I was young, I started playing guitar. And when I was a teenager, I thought it would be cool to take up bass guitar, because there's not too many girls that play bass guitar. So, you know what, if you want to be popular, do something unusual. So I started playing bass guitar, and I have played it ever since. So I still play guitar and bass guitar, but I've had a lot of noise exposure as a result. So the bass guitarist generally stands in front of the drums. So you've got your monitor mic in front of you and your drums behind you. So there's a lot of noise that hits your ears. And as a result, that was even before I was an audiologist. So I didn't understand what noise would do to my ears. When I started learning at varsity, I became a little bit more conservative with my noise exposure, and started to wear earplugs and things. But as a result, I have tinnitus from noise exposure.
In both ears or just one?
So I do have in both ears. My left ear is worse than my right. So I notice my left ear all the time. The right comes and goes. So yeah.
So Janine, we've spoken a bit about hearing solutions when you've already got hearing loss, but I suppose with your history then that you've got a strong passion for hearing protection as well. What's it like in your practice? Do you see other musicians, or what are the types of hearing protection that you offer?
So we do a lot of hearing protection for people who are shooting. And for musicians, we supply Protec ear with filters. Also, we see a lot of motorcyclists as well, so they also wear the hearing protection as well. I haven't done a lot of digital hearing protection for the musicians, but often they find that if they're just practicing, the Protec ear ones with the filters are great. The only time that it's a bit of a problem is with the singers. So it's difficult to sing when you can hear yourself inside your head. And also there's a bit of a high frequency attenuation. The other people that we see are sound engineers as well. So but sound engineers are lovely people, but they're difficult because they don't want to wear hearing protection because they want to hear everything at an equal level. So it's interesting to see all those different people.
Sound engineers are like the best and most interesting people to work with, but certainly the most difficult people to put hearing aids on as well.
Absolutely. I'm interested. I think I want to know, just to come back to music, because as you know, I am a musician myself, so I'm drawing the conversation back that way. And I just want to know, do you still play bass guitar?
I do. So I actually play in a church band now, but I'm still playing bass guitar. I like, although now I try and hide behind people because I'm 40 something. So a 40 something year old playing bass guitar could not be as cool as 20. But I enjoy it. I still play guitar and bass guitar every week. So I love my music, and I'm encouraging my children to take piano and drums and all kinds, because music is a wonderful thing. Obviously, you have to be very careful with the music and the loudness. Unfortunately, you'll know once you've got the tinnitus, it doesn't go away. But yes, I do still play.
I was going to say that we should actually make a little bit of a musical interlude with audiologists. I mean, who better to understand the frequency range and how the various frequencies will work with each other and intermingle with each other, especially when you're dealing with singers and drum and bass and guitar. So I mean, I'm it's not musical at all. I love singing, but I can't sing. When I turned 40, which was not long ago, it was definitely this year, my husband bought us a piano, and so I decided to start learning how to play the piano. And it's so complicated but so lovely. And I read a very interesting thing, and it ties into what you said now about your kids, and you want to introduce music and all right-brained activities, right? And I suppose music ties in also so well with auditory processing. I'm not sure if you see kids with auditory processing difficulties, but definitely the combination of right brain, left brain, and working the keys or working whatever instrument you have is a great integration process to be training them. But I read very interesting comment a little bit of research the other day, which said, if you want your children to succeed academically, don't invest in iPads and advanced maths and all these other weird and wonderful high-tech things. Just let your children play music. Any music will do, but it is so good for their development. I found that was so interesting.
I must tell you, so my children they started music when they were 4.5, 5 years old, and they are actually extremely good at maths. So there's that. I read an article about how music skills improve your maths ability as well, and I mean, I don't know if it's just because they're clever with maths, or if it's actually in the music that's contributed towards it. Yeah.
I'm sure it is the music, because when you look at language development as well, and as we know, maths has a very big language component. So when we see, for example, kids that have language learning difficulties or auditory processing difficulties, they do really well with arithmetic, and then they don't do so well with story sums, and they recommend introducing music. Why? Because even when we speak, and when we speak with our various intonation patterns and changing in prosody and all of that, music brings out the most salient features of speech and language. So the combination is so good, even for our hearing impaired kids that we trying to introduce an auditory verbal approach to. Music is one of the biggest aspects when they talk about language development and bringing out the most salient parts of speech. So it makes perfect sense that your kids are good with maths.
Thank goodness. Yeah. I must say, being a musician though and an audiologist is a difficult combination when you sit behind an audiometer, because you want to try and present tones that are not rhythmical. And I think Sybrand can agree that everything in a musician wants rhythm and timing. So for me to present my beeps at random intervals makes me feel very uncomfortable inside.
For sure. Janine, I want to know, in your practice currently, have you noticed, especially with the entry of over-the-counter hearing aids, that people have become a little bit more knowledgeable and empowered by knowledge in a good way, but that people that come into your practice are have done their research in terms of hearing amplification and solutions to hearing? I think, just thinking about you saying that Baha and cross systems and so forth, have you found that people are actually more knowledgeable and that they come with a lot more questions and they've done research? And how do you navigate that as well?
Yeah. So Baha and cross systems, I find people are still not aware of what those systems can do. So I find with hearing aids more, people are coming in and they say, I've seen this on the internet, or I want this hearing aid, or I've done my research and I've checked these brands, and this is the type of hearing aid that I want. So they are more knowledgeable, they're doing their research. They're also shopping around as well. We've got a lot of people who are checking prices and which is, it's not great, but it's great because, as an independent audiologist, we know that all of us are kind of doing the same thing. So if people are shopping around between us, it's okay because we're all the same. But when they look online and they want to be able to buy something overseas and then bring it here, that's where the problems come in. But yeah, I agree. People are doing their research these days, which is great. I think that people should be deciding and they should be doing the research. And then it's our job to guide them as to what's the best solution for them. So they come in with an idea and they know what they want, but then we have to say to them, look, that's probably not the right option for you, and this is why. I've had that a few times where people have come in and I'm like, no, that's not going to work.
I've also found, I don't know about you, Sybrand, have you had your patients that have come to you with something that their family members bought online? And I've had a couple of those, and unfortunately when they realize that it actually can't be adjusted, that there is no software for these devices, and that I can't verify it, I could certainly test it and see which targets it's matching, if it's matching any targets, but they generally are preset. And so the patients are also starting to get a little bit uncomfortable with the fact that they've now bought something that they know that could potentially damage their hearing. And then, so as a result or a spin-off of a negative experience, I have found that patients are more open to dealing with an independent healthcare practitioner and really then take our advice on board because of a bad experience where they thought that they could do it and realize that there's actually a little bit more to fitting a hearing aid than just buying it sort of a stock standard online. Have you found the same thing?
Yeah, and I think it's quite important, for those that are watching to know, in terms of hearing aids, that the manufacturers have controlled quite well the price adjustments to hearing aids, catering for developing countries and developed countries. So, maybe those children that want to buy hearing aids for their parents, and they think maybe if they are in Australia or America or Europe, let's maybe get it there because it's going to be less expensive. But the manufacturers control quite well in terms of the prices. So it's better off that if your parents, your mom or dad is in South Africa, that you choose an independent audiologist here in South Africa to help them, because the prices will be more or less the same. And then they're going to be with somebody that is available to help with all those little fine nuances about adjusting to the hearing aid. So that's really important. If you are watching and you're thinking of maybe I should buy a hearing aid in another country than South Africa, or in another continent, that you just take note that the prices are more or less the same. So it's better to get your parents at an audiologist that is available
There's been a couple of patients that I've seen where people have decided to go other places other than an independent audiologist. And they've actually ended up having quite a bad experience, just because maybe the time wasn't taken or the right fitting verification, all those kinds of things were not done. And what's happened is that they've got a very negative experience. And yes, it's damaging our industry a little bit, but then they come to us for a second opinion, and they see the time and the effort that we take. And I think in a way it's getting the awareness out there, and it's not great that people are selling things online, but at the end of the day, when people come to see us, they realize the value that we have, and they realize that going to an independent audiologist actually ends up being a better experience and not costing them any more than what they would have spent somewhere else.
Absolutely, couldn't agree with you more.
Yeah.
And also, that's what I was going to say, was when you buy something online, you actually don't know whether you can have that device serviced anywhere in the country. And if you're just dropping it off at any person who says that they can service a hearing aid for you, that's also problematic, because if the device that someone's bought online comes with some sort of warranty, then that could be deemed as misuse if you've handed over your online purchased hearing aid or amplifier or listening device to a person that's not linked to that company. Then they could damage it even further, or you could lose the warranty. Whereas as independent audiologists have a really nice relationship with a variety of manufacturers, and each manufacturer has their own laboratory and service department where we can send it, and we know and we can trust that where we're sending it, they're going to be using new parts, the correct parts, etc., and that their warranty is not going to be foregone. So that's also, I think, a really important factor to take into account when it comes to buying over the counter, or thinking that buying something online is going to replace what an independent audiologist can do for you.
Yeah, and there's been research studies as well to show just the successful outcomes being much more when a person actually has an audiologist that they can sit with, that counsel them through the use of these devices. So yeah, it's good, backed up by research as well.
100%. So what I'm going to do is I'm going to almost bring the interview to a close soon, but I wanted to ask you, Janine, if you had the world at your fingertips and you could tell any person in the public anything about that audiology and independent audiology that you're passionate about, what message would you give to someone watching this for the first time?
I would say that hearing is a passion of mine. So hearing music, hearing sound, hearing people. I love people and I love communication, and I realize how important it is for people to communicate, to stay connected in their relationships and in the world around them. And my passion is making people aware of the fact that if you're not hearing and you're disconnected from the world, you're missing out. And you want someone to help you on that journey of communication. And audiologists are people who are passionate about communication. I'm passionate about making people, giving the people the opportunity to hear again. And so in the practice, when you fit a hearing aid and you see someone who hasn't heard properly for a while, their eyes light up and they're so excited, they can communicate with their families. It's much bigger than just the structure of the ear. It's much bigger than, just hearing. It's actually improving quality of life. So that's the one thing that I enjoy, is that when people walk out the door, I haven't just put a hearing aid in their ear. I've actually helped them with their relationships, with communication. The husbands and wives who complain that they don't listen, now they have no excuses because we've helped them out. So yeah, that's what I want people to understand, is that what we do because we love it. but we do it also because we benefit from it. We see so much happiness in our job. People think it's terrible. People say to me, oh, I can't believe you have to deal with hearing loss every day. It's not like that. It's dealing with hearing and helping people to have a better experience.
And Sybrand, any final messages to the public based on what Janine has said to us today?
Well, I would just echo those thoughts to say that it really is valuable for a person that has been experiencing the hearing loss and experiencing some form of emotion attached with that, whether it's anxiousness or anger, some form of loss, apart from the hearing loss and emotional loss as well, that it's so valuable not only to get the solution and the correct solution from an audiologist, but to sit with somebody and talk through what you've been experiencing, and having the opportunity to discuss that and giving words to what you've been experiencing, and really having somebody that understands, because they've got the experience, that understands what you have been going through. So if you are listening and you know that your hearing is not exactly what it should be, do take that first step. First thing you have to do is go to the audiologist, get the hearing evaluation. Don't think too far ahead. First get the hearing evaluation, and that audiologist will guide you through the next steps.
And one thing that I wanted to take from this message to the public is that if you experience a sudden drop in your hearing, don't wait and think that it might be fluid in your ears or it might be an infection. Please go and see an ENT or an independent audiologist to have it assessed immediately. It's great if they find an infection or wax or fluid in your ears, because that's treatable. But if a permanent sudden sensory neural hearing loss is found, there's more that can be done for you the sooner you have it treated and diagnosed than if you leave it to just linger. So that's my little piece of advice that I would give based on having chatted to Janine today.
And Cara, Shane, just on that, so I think, what is new to us now is if you've had COVID as well, a hearing screening would be worthwhile, just simply because there might be something there or there might not be, but studies are showing that hearing loss can be related to COVID, and I think it's a hearing screening would be a good idea.
Thank you so much, Janine, for joining us today. So nice to get a personal touch and feel for who you are. And I'm sure that your personality has resonated with a lot of people in the public, especially obviously close by you, and who are going to want to see you as a person and also realize that us independents don't bite.
No.
Much.
Not much.
So thank you very much for your time.
Thanks, Sybrand. Appreciate it. Thanks for your time.